Thank you very much. It is a struggle trying to be a little different and being able to, understand that you're trying to save an animal's life, or you're trying to save your own life. And again, people have built me up from Marty Goldstein is the one who taught me about ozone, and then and Tina Aiken taught me more, and then Judah Shoemaker, who's speaking, each taught me more. And then when you want to know more, you want to know more. You just can't stop and not understand more. And I want to just give a little backstory about myself. I've been practicing for 42 years, but 42 years ago, I was hit by a cow against a fence that the farmer was too cheap to put fencing in. So he 5-inch nails. The 5-inch nails penetrated my back and hit my pericardium and my sternum. And it was misdiagnosed on my spleen. So long story short, they ended up taking my normal spleen out and then told me that I had 3 months to live because I had cancer in my chest. And meanwhile, my diaphragm was paralyzed because my phrenic nerve was cut. And so I have asthma. So between those three things, I have been looking for something in my life that could protect my immune system and help my lungs. And so for 42 years, I have worked in bioterrorism and preparedness. I have looked at zoonosis because I wanted to survive. And when I found ozone, and this was in 2003, I started using it on my horse. I thought, oh my God, I found something that can protect me, my immune system, help me get more oxygen into my body. And if there ever is some kind of pandemic, we have a tool. And I'll tell you, when this pandemic started in late December, I started on a mission to educate people about ozone. And I have hit a brick wall and a brick wall and a brick wall. They don't seem to get it. And it is so important for all of you to listen to this video and reach out to your hospitals, reach out to the doctors, reach out to your politicians to know that there is a choice. We can do something. We cannot let these people just sit there and their lungs collapse down, fibrosed, and the ventilators aren't working. So this is why I decided to talk about this, so I can share with you all the knowledge that we're pulling in day by day. Karen Gelman and myself have a website, and I'm going to go to that next. And so this is my clinic in Hopkinton. We do an array of integrative modalities, and ozone was added in 2003, but we do a lot of other things as well. A lot with microbiome, and the microbiome and the oxidative therapies work amazing. We're going to give some cases at the end. So this is a letter that we have recently sent out, and you can see the Dr. Gelman's contact and myself, and we've put it on her website, which is the Plenacure Vets, and it's also on the MASH Vet link, and it's giving you all the current articles in real time. We've been communicating with the Italians and the Spanish, and now we're hoping to get some Chinese studies using medical ozone to try to see if we can stop the virus from infiltrating people in the beginning, and then trying to keep them from going on ventilators. Because once they go on a ventilator, the fibrosing of the lungs is so serious that it's almost impossible to get them off. So they're using extracorporeal blood now, but not bypass machines at Maimonides, but those are really much more expensive than ventilators would be. And if we can use medical ozone, that would be amazing. So I'm going to show you what I think. So how can we prevent and control such an invisible attacker? We need to look at tools of the 21st century and not be afraid to use the tools from the past. We need to think open about the possibilities to think outside the box. And there's a link here if you guys want to go back, listening to Dr. Mercola talk to Robert Rowan. And I'm taking quotes from Robert's presentation on the COVID. Robert, and I'll go into his in a little bit more. So these are some quotes. Robert Rowan, this is his quotes, increases what we call arterial venous oxygen difference. If there's arterial oxygen and there's a venous difference, that's what's between what your body is consuming. Oxygen increases that, so that if you get a higher amount of oxygen that actually is being consumed by the body, which can be only done at the mitochondria, meaning more ATP. ATP is what makes the body's energy, and we need to have more oxygen combustion to make ATP. So the whole idea with what's happening with these lung damage, they're not getting oxygen into tissue. The lungs are expanding with the machines, but they're not actually getting the oxygen. Ozone has all of these effects and more. It increases nitric oxide production in the circulation, improves circulation to any event, and all of these factors, all of these biochemical effects of ozone go into its effectiveness. Additionally, both groups found that ozone molecules create ozonides. Ozonides are reactive oxygen species or lipid oxidation products that are created on contact. When ozone contacts components in your blood, ozone reacts with them instantly. Ozone doesn't last more than microseconds in your blood, and if that, and then the molecules are made into ozonides. Those ozonides move through your body and are chemical messengers in the body, and they will also kill the viruses. So this is why I'm just taking his quotes from it. This is his quotes. I decided to go to Africa in 2014 because knowing that what I knew about Ebola itself, I thought that ozone would be an ideal therapy. Because of the similarities, in particular similarities of the Ebola's viral coat to corona, I also believe it will be an effective treatment for coronavirus. I recruited Howard Robbins to come with me. Howard Robbins does a rather inexpensive, quite safe form called direct IV ozone, DIV. The only downside it has is it irritates the veins. And if it can irritate, you have to be careful that you're not giving too much outside the vein or any outside the vein. I haven't seen any other issue. We use low concentrations, so we don't see any other issue. It can cause a cough and a tightness in the chest, which goes away in about 5 to 10 minutes. So this is controversial, but I'm going to get into a little bit more. I just want to give you some of these things that are out there that you can really look at. Now, Vilio Bacci, who we all consider the father of ozone therapy, who was a skeptical researcher who thought ozone didn't work, and ended up building his whole career around figuring out how it worked. He also found that ozone increases the level of key antioxidant enzymes like glutathione peroxidase, catalase, and superoxidase dismutase. It modulates the immune system, increasing certain cytokines, and reduces inflammation, decreasing certain cytokines that increase inflammation. So we're worried about this cytokine storm that's happening with this pulmonary inflammation, and I think that ozone could be a real big part of that to prevent it. The ozonides are, in their own right, a reactive oxygen species, ROS, and they are strong electron seeking. When they are not as lethal to microorganisms, while they're not as lethal to the microorganism in ozone, it is one of the other mechanisms of ozone. Ozone kills microorganisms virtually instantly, including viruses and bacteria. And that's one of the reasons I use it a lot in my microbiome restorative therapy or my fecal transplants. At my practice, we've done already 8,000 fecal transplants, which we call microbiome restorative therapy. And because we want to reduce the biofilm, we want to reduce the viral load by bringing the ozone into the gut and reducing that, we are getting so much more success with our fecal transplants than any other place in the country. Because we use the ozone, and all the vets that are doing ozone with their fecal transplants are seeing those same results and very, very positive results. While hosts of downstream metabolites called ozonides are produced, they are reactive and they stay in the system and will continue to help the body and regulate the immune system. Not as reactive as ozone, but they will do their part in helping with the viral infection. So this is something why ozone is good for the COVID. When the lungs fill with fluid, they don't get air and you die. Ozone increases 2,3 DPG in red cells. That causes more oxygen to be released by the hemoglobin. Oxygen improves red cell flexibility, and a red cell has to go through a very small blood vessel. I mean, they're much bigger than the blood vessel, but it allows the blood vessel the blood cell to be a lot more flexible and to move into these very small areas, especially if the lungs are fibrosed. If you can get ozone to help those blood cells work more efficiently, then hopefully they can get into the very smallest blood vessels. I linked over on this thing to a YouTube teaching thing on 2,3 DPG, which I think is an important component that conventional physicians should be looking at. They show that ozone reduces human necrosis factor, TNF alpha. When animals were preconditioned, in other words, if you gave them ozone treatments before toxic insult would kill them, it reduced the lethality of the insult, whether it was chemical, stress, or infection. And Sylvia Menendez did a lot of studies with Zule Zamaro as well. And another, and these studies are available in her book, which is behind me. But the interesting part is that if you can precondition the people and they get the ozone once they have been exposed to the COVID, then hopefully they don't get, their bodies are more resistant because they have a lot more ability to defend themselves. So we need to get this into the system before their viral load gets so outrageous. So here's what the Italians doctors found on, this is March 30th, 2010. We have a first data of the ozone affected by the COVID. From the first report, 1 out of 17 hospitals where ozone is being performed according to the protocol of the Scientific Society of Ozone Therapy, 10 patients in serious or very serious conditions had a rapid and decisive improvement. Just after 5 treatment sessions, all of the 5 intubated, 1 improved to the point of being extubated, and the others are improving significantly. The patient is in less serious condition after a few sessions of the ozone oxygen therapy, recovered and returned home. The groups only was in a widely compromised condition. Ozone therapy was practiced in extreme attempt, but there was nothing more to do. In a technical report, the doctors wrote that 5 treatments of ozone therapy per protocol, the patients were much better. So what it did is it did a general improvement of clinical conditions, normalization of body temperature, which is important because the people are running such high fevers, reduction of reactive C proteins, which is a marker that they can see, normalization of the heart rate, and improvement in saturation and reduction of oxygen support, normalization of renal function. I mean, I use it in my kidney failures all the time. I mean, that's one of the things that I use, ozone, and also the microbiome stuff. But anyway, so here's another one that came from Italy, and they did 30 cases and 32 cases and that were people destined to go on a regulator there, on a respirator, and only 1 had to go on the ventilator. So that's amazing stuff that needs to be shared, and people have to scream. I've been trying to knock on doors and talk to people, and it is so frustrating. They hear the word ozone and they send me to the EPA, and I've submitted reports and they just keep sending it to EPA. It is ridiculous. So these are some of the doctors that are working in these 17 hospitals. So to better, this is just what Dr. Francini, and the Italian group has been so ahead. In Italy, I spoke in Italy in 2013 at the World Congress of Ozone Therapy. And it was amazing to be able to hear doctors from all over the world speaking like the United Nations. So we had doctors from 6 or 7 different languages. We all had headsets on. We could talk to each other through the interpreters, it was wonderful. But the most amazing part that I thought was really, really special was that after this medical conference was over, the World Congress was invited to the Vatican by Pope Francis to get blessed because all these people were saving so many lives. And what it frustrates me that medical ozone has not been utilized in our country. And it's really sad. And because the FDA wants drug therapy, but ozone is a drug, but you can't patent it because one of the first generators was built by Nikola Tesla over 120 years ago. And they can't patent the process of making ozone. So it's not something that people feel they can access, but it is absolutely what everybody could have in their home, treat their animals, treat themselves, have this as a simple ways of doing it. And I want to show you some of the simple ways that we can use ozone. You can ozonate your personal protection equipment. So I'm going to show you can drink ozonated water. You can bubble to produce ozonated water. You can bubble and produce ozonated oils. You can use ozone gas to disinfect packages and contaminate items. You can use ozonated saline or water to flush your eyes, nose, and to gargle. This is what I want in every single hospital for all our first responders and all our professionals that are putting themselves on the line over people that are sick. They need to be able to wash their faces and eyes and mouths and gargle and do neti pots to get rid of the viruses within their throats and their sinuses. If they can kill those, and you obviously are not going to put Purell up your nose. And so if you could actually get this stuff to be killed by flushing yourself with ozonated saline or ozonated water, you can do rectal, vaginal, or ear insufflation. And we're just going to show some pictures of things. Okay, using ozonated oil. One of the things that you can do is ozonated oil is the ozonides are in there and they're sort of suspended in the oil. And you can take some on a Q-tip and put it up your nose. I've been using ozonated oil when I travel on planes because I don't want to catch a virus. And I've been doing this for like 15 years. And I put it inside the mask and then I put my mask on. So I've been wearing masks and gloves to doctor's appointments for most of my life. So having everybody wearing masks and gloves seems like, oh, everybody else is doing it too. But to have that ability to, if you get air through there, that ozonides are being supported in there, you can actually hopefully reduce the viral component of it. You can use as suppositories, you can give it rectally, you can put it around your gums and swallow, and the benefits of reducing ozone. So I don't know if my mom is listening to this, but I'm going to just tell you, she uses ozone. She's 91. She thinks it's the fountain of youth. She broke her arm in September, and they said you're going to be in a sling for at least a month and a half. And then, in like 3 weeks, she had another x-ray, and she was doing ozone every day, drinking water, putting it in her water pick, and then taking homeopathics and eating extra, calcium, cottage cheese and stuff. She went 3 weeks for a follow-up x-ray, and the guy came out and said, you healed in half the amount of time of a teenager. And she told him what she did with ozone and the homeopathics. And he looked her straight in the face and said, it's your genes. And he walked out. And she's been using it in her water pick since the COVID started in China. And I said, you've got to use it every day. Put it in your water pick every day. She was doing it several times a week, but every day. She went about a month ago to the dentist, and they came out. He never had seen her before. He said he's never in his life seen somebody 91 years old with the healthiest gums he's ever seen. So it reduces the biofilm. It gets rid of this whole overgrowth of bacteria, allows it more to balance out at the end of the day. But if we can use it to kill corona, that would be great. Okay. So
just a reminder, you got about 10 minutes.
10 minutes. Okay. Ozonated saline drip, major autohemotherapy. These are things that a professional person can do. Hemolumin, which is ozone, UVBI, UVA, UVC, red, blue, amber, green, and red light. UVB, which is all the ultraviolet. And then the Robin method of DIV. So if anyone's going to do that, they need to take his course, and he's offering it, Ozone Without Borders, so that doctors can take that course and be delivering it, because his method is a very, very quick but it's not appreciated in Europe, but he's doing it. And he went to Sierra Leone and treated 5 cases, 5%, 5 of them successfully, 100% success. And it cost us $7 a patient to do. So this is washing your hands, wash your gloves if you're using gloves. This is using an ozone generator to do our vegetables. When we get back from the grocery store, we plop them into water that's been ozonated. And then I put plastic over the top, and the same little generator, fill up a big tub with ozone, and then cover them up and let them sit there for a while. And that's how we do our vegetables here. Reusing your PPE, you can pump that gas into the mask in a Ziploc bag and use it again. You can also hang them outside and let them get UV light from the air. We're putting our personal protection equipment in a plastic bag, and just like bagging the legs that we talked about, we're going to bag our personal protection equipment. And if you're going to take it out sooner, do it outside, because it will cause irritation. These are ozonated oils, and you're looking at the oil here. The oil is very dense on one side, and that's when it gets where you can use it as a salve and put it on your nose. This is where you want to use it if you're going to be bubbling it. How can we prevent? We can just keep flushing, and we talked about that. So here's just a quick making ozonated fluids, and here is a video of how when you make the ozonated fluids, you can see them bubbling. Here's your destruct. Here's your little. This is the little hummingbird that O3 Vet sells, and they're a water maker. And you're making your ozonated fluids. You can make it in bigger volumes than that. Okay, I'm back. Did I lose my slide? Am I done? Didn't finish. Where's my slides?
No, I get your slide back on.
Okay, sorry.
So.
Because this is, I have to say, this is, to me, the most important thing that I can share with my friends and share with everybody is we have to get to know this. This is the destruct. This is breathing ozone here. So I'm hooking myself up and breathing it through olive oil. And you can only breathe it through olive oil. You cannot breathe it directly. So you want to buffer it through. You can see the ozone bubbling right here. So we want it to be bubbling nice and cleanly like that, because if you bubble it too hard, I've lost my slides again. If we can bubble it through there, then that's how you want to have it done. The other one is just showing the bubbling happening. And then you want to use distilled water, or you can use filtered water. And then this is how we're making ozonated saline in bulk. I use a glass saline maker, and I love it. But they are hard to set up and very fragile. But this is something that I learned from the Brazilians, is using this. So it's basically they take a small needle and perforate a saline bag. We've hooked up the saline drip to the machine. You got to make sure that you have a valve that won't flood it into your machine. You come down here and you're going to see there's a hole right here. I put a needle into it, and they're bubbling the saline right into the bag. It's not something you would reuse over and over again, but I learned this when I was in Brazil, and I love the Brazilians. They are so creative. When I went there, they had over this was 3 years ago. I lectured for their World Congress that they had, and they had 600 vets that were doing ozone therapy there. They're so ahead. They're amazing. So let's see. I keep losing my slides. So Jonathan, can I get back to my slides? Because I don't want to lose my time. Okay, so the next one, these are charts that anyone can look at now that Dennis Mahalka did on the stabilization of saline in water and how many hours it lasts and how many micrograms per milliliter. So I'm not going to go over that because I don't have time. But it's great that he put this together about using water and how we can keep more of it in it if we keep it cold. And we bubble it in our clinic every day and keep it in the refrigerator. And we use it all day long, and it can last a lot longer, and as well as saline. So making ozonated saline to give to your patients is something that we could all do. Getting a glass maker is great. And we need to look at why ozone stimulates the mitochondria. I just want to now I'm not going to go into the microbiome. This is doing rectal ozone for those of you you can do this at home as a pet parent, and by rectal ozone. We're doing this for our fecal transplants. And so we can give it orally, or we can give it rectally. When we do it orally, we usually don't give them ozonated water, but you can. And we are also using the water from my dog's water bowl to establish a biofilm. My dogs are 7 generations, 27 years of eating organic food, and 5 generations of standard poodles. The big thing I want to talk about is bacteriophages. Bacteriophages may be the reason we can get over this virus. And if we do fecal transplants with ozone, we may be able to conquer this. And I want to just give you a case. This is a case of corona in a cat. This is a long time ago. Stella was a 5-week-old kitten, obtained 2 days before the entire cattery came down with feline rhinotracheitis and respiratory disease, which was a coronavirus. The whole kennel ended up dying, but she was already out of there 2 days. She had presented lethargic and signs of a beginning of an upper respiratory infection. She progressed much worse and was not eating and severely congested. We bubble her through ozonated olive oil outside the clinic. I didn't want to bring her in the building. Placed her in a plastic bag confined with the ozonides, and she was struggling to breathe. She was drooling, and massive amounts of foam and fluid came out of her mouth and nose. And like I said, everybody else in the kennel was euthanized. On the way home, the owner said she had to stop, and she pulled out like ropes of discharge out of her nose and her mouth and everywhere. And she was coughing up this massive amount of mucus. Okay. She completely recovered and was back to normal in 5 days. The ozone, I think, killed that virus and allowed the lungs to decongest and heal. She was supported with herbs and homeopathy and a great diet to regain her health. But this is Stella probably around about 2.5 weeks after that. She's on the front of my brochure. But she lived till 14 and a half, and we treated her with a lot of ozone. She lived 3 years with malignant adenocarcinoma of the mammary gland. So she's also a cancer survivor, but recently passed away. Okay, the last one is, I think, amazing. We had an entire kennel break with 20 dogs with parvo, and they were PCR confirmed. And a 20-pound, 9-month-old sled dog was taken to the emergency clinic in New Hampshire and was treated for 3 days, intensive care at a cost of $3,000. The veterinarians of the clinic said there was nothing more they could do for this puppy. They recommended euthanasia immediately. So the woman called me and said, do you think you could try? And I said, well, let's try it. Why not? So they came down from New Hampshire, and I wouldn't let her in my building. I kept her in the car due to the contagion. And I did not know the puppy was still alive. I looked at it. Finally, I saw a breath. Its face was, its mucous membranes were pale. It was totally unconscious, no anal tone, no reflexes when I tried to touch its toes. I didn't think it was alive. But I gave it ultraviolet light, UVB eye treatment, because it had a catheter in, gave it sub-Q ozone, gave it injections of vitamin C and B complex, vitamin A and D, rectal ozone, and a fecal transplant from my dogs. Okay. The owner drove back, placed the dog on a third floor in isolation. So an hour and a half drive back. She was making dinner 4 hours after our care when the puppy came down 3 flights of stairs and wanted to eat. So this is unbelievable. She couldn't believe it. We treated the other 18 remaining dogs with ozonated saline and a fecal transplant orally. The mother of the puppies they were 6 weeks old that was in the ER was the only one that did not get ozone and a fecal transplant, and she died. So the entire kennel survived with ozone and a fecal transplant. I did also give them a homeopathic of parvo homeopathic too as well. So could there be a connection between the microbiome and the ability to recover one's immune system from pandemic? The value of ozone to reduce the biofilm so the fecal transplant and the MBRT can work. We need to explore much more as these pandemics become more common due to the ability to create genetically derived viruses. We need tools to let our bodies heal and come back. We need ozone to make that happen. So that's MASH, my clinic, and I am looking for another veterinarian to help me in my practice. So any of you out there that are interested in working in our practice in Massachusetts, please contact me. You can reach us at mashvet.com. And again, thank you very much for all of your time, guys. And we need to have voices out there. You have to go and talk to people and let them know about using medical ozone. It might save their lives.
That's great. Margo, stay on for just a second. So a couple quick questions, and then we'll get to some of them later today. Mm-hmm. What concentration of were you using for the ozone and the PPE, and how long did you keep it back for?
On the website, we're going to be having a video piece that Dr. Gelman is doing. It should be out today or tomorrow, and it's going to go in detail on how to do all this stuff. Exactly how to do it. When I was hoping to have it done for this event, it might be up there now. And we've got a range between 40 and 70. So I think somewhere between 40 and 70. Some people are saying 40 is fine. Some people are saying 70. I say 70 because I just want to be sure. So yeah. Getting it higher and being sure. One thing about putting it on higher, it will break down the rubber in some of these masks that are, these disposable masks. But we've been doing it, and it is holding up. It's just, they have this new machine that they brought into Boston. It's made by the company Battelle out of Columbus, Ohio, which is a hydrogen peroxide producing machine where they can do thousands of personal protection equipment in one swatch. So they set up a whole room. They set it up like a laundry hangout, and they release the hydrogen peroxide, which is an oxidizing event as well. But ozone, you can do your own stuff at home and actually do this, and hospitals could be doing it. First responders can be doing this after they get out of the ambulance, and we're taking the person, they can make ozonated water, flush their sinuses, flush their nose. We're trying to get our first responders in my town to start using it. We just opened up in Massachusetts the first COVID treatment center using ozone, they're using ozonated saline, they're using glutathione and vitamin C drips. And they've done already 7 patients as of last night.